CAHN Health Hour with Black GPs and senior consultants giving Black health advice, improving Black health equality. CAHN Health Hour.
Good morning, everybody. Welcome to our first health hour of Saturday of December. Thank you for all of you joining us. My name is Ngozi Ediosage. I'm a pediatrician. I'm also the medical lead for the Caribbean African Health Network, and I work in Manchester. I'm delighted to welcome a number of colleagues this morning, and I think it's quite apt that we're talking about spirituality in the month of December. We all know the connotations that December and Christmas has in the Christian calendar. And today we're going to be focusing on faith and health in medicine. So I'm delighted to invite a number of colleagues who are from a medical stroke pharmacy background, but also have a strong faith. And if you put into Google faith and health, one of the things that you will see is that if you have faith, people who have faith report feeling better and healthier. And there's also been a number of research papers that have looked at the impact of your faith on your health. And for those of you that join us on a regular basis, you will know that we have questions every week on the place of faith in our health. So we have a number of colleagues who are going to tell us about their personal experiences, and also people who are deeply religious and can bring that clinical interface and intersection of health and faith and talk to us today. Now, we're usually a lively bunch, so please keep your questions coming in the chat box as we engage with our colleagues. So I'd like to welcome Dr. Ayo Olatoye, who's been here before, and thank you for joining us. And he is a consultant in acute medicine. I'd also like to welcome Dr. Esther Oludipe, who is a pastor and a qualified pharmacist. We also have Dr. Joe Omofuma, who's a GP in Rochdale, who'll be joining us, and Dr. Mohammed Kamara, who is a consultant in emergency medicine at Tameside. So welcome all of you, and thank you so much for joining us this Saturday morning and giving up your time for what I think is going to be quite a stimulating discussion and a really important topic as well. And I know that because every week we get questions about the role of our faith in health, whether we should take the COVID vaccine, whether we should take medicines at all. So I'm just going to start by just getting some sort of background about how you use your faith in your work. So I'm going to start with you, Ayo. Thank you for coming. I know you've been here before, so you're a repeat
offender.
I was going to say offender, it didn't sound right, but thank you so much. We all enjoyed the last time you're here with us.
Thank you. So faith and how I do it personally, is that the, so I mean, what your background is in terms of your health. Right, okay, fine. So I'm a consultant
in your faith and where you work.
Fantastic. So I'm a Christian, first and foremost. I am a husband, son, father, brother, uncle, lots of different things. I'm also a consultant in acute medicine. I work in Merseyside. I live in Manchester. And I had a stroke last year. Now, in terms of faith and health, I think it's always been my opinion that regardless of the medium, healing comes from God. So I've never really had a conflict with regards to being a doctor and being a Christian. And if I'm honest with you, the way that my faith, because I believe that the word says everything that you do it with all your might. So I think my personal opinion is that Christians should be, you know, the aim to be the most effective of whatever work their hands find to do. So I take my faith to work by asking God to help me get to the diagnosis. Not only get to the diagnosis, but also communicate in such a way as to make people feel understood, but also seen. So for instance, this is a long windy answer, I'm so sorry, but I see pneumonia all the time. But sometimes when you tell somebody, oh, I think you've got pneumonia, they're like, pneumonia, because it's a really big thing. So I do my best to make sure that I can be a representation of God and love and grace at often people's darkest time.
Thank you, Annie. That's really interesting. And I think all of us who are medical here will understand bringing that belief and security in having a faith to bring it to your work. And I can understand how you say you don't have a conflict. I think this next question is really well answered by Pastor Oludipe, because it's about medication. For many of our listeners who tune in every week, one of the things we discuss often is about the role of medicines and whether it's important to take your medicines or whether you can rely on your faith. So if you can give us a little bit of background on what you feel about medicines in the role of health.
Okay, thank you very much. Just before I go into that, I would just endeavor to let our audience know that when we are talking of health, it's not just the physical health. So we're not just talking of the health of the body, because we know that human beings are spirit, soul, and body. We all know that, whether, you know, Christian, any kind of faith, any kind of person. So you know that, you know, you train your intellect. That's a different part of you. You've got your physical body, and of course, you know we have the spiritual as well. So when we are talking about a well-rounded health, we're not just talking of what the physical illness that, you know, people would say, because some illnesses will emerge from what is from the inside, you know. So I just said I should put that clarity. So in terms of the medications that we get, we know, for instance, there was a case in the Bible where there was a king, Hezekiah, who was just going to be terminally, you know, it was already told by a prophet to say, go and prepare your house because, you know, you're going to die. And then it was God that told the prophet to go back to Hezekiah and tell him, okay, you will not die. I'll add some more years, but this is what you have to do. He had to go through to make some poultices of figs. And we know that figs is antibacterial. So this was a prescription from God to say, yeah, go and use that poultice of figs. And Hezekiah got healed. So in essence, our role is to prevent ailment. But if there is already an illness, then we have to tackle it at every end. So we have to tackle it maybe with medication, we have to tackle it with prayers, because at the end of the day, what we want is that that individual be healed and they don't suffer from the ailment. And if somebody hasn't got that enough faith to say, I will just through prayers take care of this ailment, then we advise them that it's better you just take your medication. It's not going to be that the medication might work. You still need to pray that even, you know, what you've been prescribed, that, you know, God will help you to work. So this is just how we counsel people in terms of their medications and their level of faith. Thank you.
So use both, really. And it's interesting that you said something about it's not just the physical, it's the mental, because I think all of us who work in healthcare have seen patients that receive a diagnosis and seem to give up. In actual fact, it means that there is some influence about your own psyche on the way you interact with your healthcare. Dr. Kamara, are there any aspects in the Quran that could help people to understand that there are sort of the intersection between your beliefs and health, that it means that you should engage with health practitioners? Are there any pointers that you can point to people to look at, the people who perhaps don't want to engage with healthcare?
Yeah, thank you so much for having me. The short answer to your question is There's two professions mentioned in the Quran, and that's the one of a doctor or a medic, and the other one is the one of a teacher. So if that's the short answer, then yeah, that's what it is. I can go.
What's it say in relation to the medics?
Well, it's a noble profession, and it's one that has to be, if you like, it's one that you can't even reward, because the health, you can't, if you like, put a price or value, at, as it were, you can't value it enough. And it's always said in the hadith, that is the prophetic sayings, that you're advised to take from your wealth for your health and use your health for your hereafter, i.e., it's only when you have good health that you'll be able to worship as best you can in order to achieve, the holy grail of heaven, if you see what I'm trying to say. So it's a definite causal, relationship where you put this in order to actually gain that. Really, it's quite obvious that if you do not value your health, cherish your health, then clearly you don't expect to be able to worship as, as committedly, if you like, or maybe as fulfilled as you would have liked to. And therefore, maybe you're shortchanging yourself. So therefore, you're always advised, if you are unwell, seek help. It's as simple as that. So if you say, I leave this to God to heal me, then probably you're not heeding the word of the prophets who were sent by God. It's as simple as that. So even the prophets were unwell, and therefore they sought, the help they required.
So in terms of that, one of the things I just wanted to clarify, we've heard from both religions, lots of religions, that the religion itself is used as a means to say, we won't take the COVID vaccine. So I've seen those WhatsApp videos. I mean, I don't watch them, and I hope people in here give them very little credence. But we know that there are many people that are using religious beliefs to say we shouldn't take the COVID vaccine. What would you say to anybody like that that's seen those videos, that we can have a counter argument or a counter, some information that will counter things like that?
Well, thank you for that. It's a good question. Now, as things happen, the plague itself, which is akin to, if you like, what we're facing, is actually, in the Quran. And it's actually kind of, if you like, there's always a situation whereby you're advised, if there is plague, wherever you are, you're advised to stay where the plague is, do what you can, protect yourself as best you can, and wait for the plague to subside. So those who die, obviously, that's the way it was ordained for them to be. Those who survive, obviously, would have to continue doing what they have to do in terms of praising and worshiping God. If you're outside of that environment or that place, then clearly you're advised not to leave where you are to come to there. Likewise, if you're in the plague area, not to leave to go until things subside. Now, one thing I can tell you is that you are well advised to obey the message of the messengers from God. It's as simple as that. And
one of the from God being the doctors and
the message is that they say, Ati'u Allah wa Ati'u Rasul. Obey Allah, the God Almighty, and obey His, messengers. And one thing they say to us in Islam is that you, as an individual, have to obey the laws of the land that you live in. And if the law of the land is such that these vaccines have been tested, have been proved to be helpful, they've saved how many? I think it's about 18 million lives from what I know so far from the data, because of the vaccines. We know 55 million people died in 1918 from the Spanish flu, and 550 million people, 500 million people actually contracted the illness, and out of those 55 million died. So we have to be thankful, to God to actually give us these scientists to actually manage to get this gene, the genomic sequencing of this virus, that from there that we actually have got a preventative measure that we're all taking now. So
I think that's really that's interesting, because I think from what you say, it's important that we listen to the rules of the land, and we can see the impact it's already having. I'm just going to go to Dr. Ayo. Dr. Ayo, you going to say something about vaccines and
yeah, I was gonna. So I think it's important for us to make sure that we're putting some distinction. So my name is Olatoye. If people start to follow me and they become Olatoyans, I don't know, that would be the thing. And then they do something like they throw baby off a cliff. That doesn't mean that's something that I sanctioned. So we have to be mindful about the fact that some people are using the name of God and the accoutrement, if you like, of faith, and saying things that aren't necessarily representative of what the Bible says for me as a Christian. So I think that's number one. Number two is I think that it's also important to make sure that we as Christians are careful about, sometimes there are things that God said to me, but it's a personal conviction for me. And I want to make sure that I'm not necessarily then saying, well, all of you guys have to, for instance, God told Hosea to go marry a prostitute. Now, that's not something that we then have to make law for everybody who follows God, is what I mean. So we have to be mindful of the fact that some people may understand that the thing that God is saying to you is for you. And it's not necessarily something for everybody in regards to conviction about medicine or not medicine. I also personally find it telling that we're having very heated debates about COVID, but we've not really had lots of conversations about medicine, so I personally think it's telling, and it's motivated by something other than conviction about medicine. It's probably more to do with our concern about the virulence of the COVID vaccine. That's my opinion.
I think that's important. An important distinction to make and to clarify. Pastor Esther, can you give us any examples where you as a health professional have seen where someone's faith has really helped them in their health journey?
Okay, so I would give, I've got various examples, obviously, because I've been in the pharmacy field now for over 35 years. So I've had to deal with, both counseling people in various aspects. So now with faith, the Bible defines faith as the assurance of things hoped for. So sometimes someone says they have faith, but they don't even have the hope. And you can already see that they're walking not in line maybe with what they think they believe. So it's good that people should know at what level they are, because I've dealt with an asthmatic patient who said, I've got faith, I'm healed, and they didn't use their inhalers. And then, things turned for the negative for them. But it was not certainly like faith they had. It was just maybe they just felt like a bit like they wanted to try out, what they have heard, maybe in a sermon or something like that. So if somebody is operating in faith, let them operate in faith, because their faith will walk away for them. I've seen instances also where people have said, I've operated in faith, and I'm talking of terminal illnesses, and I'm still working on 2 of them, even right at the moment, terminal illnesses, where they've come in, like, say, from Nigeria. The doctors here have done what they could do, and they've said, go back, there's nothing, we could do anymore. So just, palliative care. And they're coming out of it because of their faith. So it's so, faith does work, but it has got to be faith. It's not just got to be someone who is trying, to say, I've heard this, I'm going to use it. Everybody, not one size fits all. So everyone is got to know at what level they are. And this is where we say individual counseling would really help. So yes, faith has hope, and hope does not make ashamed. And there have been very many instances where even in my personal life, I've had to use my faith to overcome, illnesses. So there is nothing wrong with faith. But if we are going to operate in faith, then it's got to be faith. It's not just got to be, I'm trying this thing out because it might not work for them.
I think the other thing I've just realized is that although Dr. I introduced himself when he spoke, you didn't introduce yourself or what your background is. So you want to just give a little bit about your background before I move on to the next speaker.
Okay, so I'm Esther Oludipe, and I trained as a pharmacist, firstly in Nigeria, and then I came over here and I qualified as well. I finished from the University of Ibadan in 1986, and then I came over to England and I was able to get on the register in 2003. I'm also a Christian and a pastor and a pastor's wife with the New Covenant Church in Manchester. So, and I've also been in research. So the doctor you see there is just a PhD, because I've been in research, and my research has been in many of the folklore medicines that we use over there in the tropical. So yeah, that's me.
Okay. You want to say anything about your research? You say it's folklore medicine.
Yeah.
That's looking at whether they work or not work. What was that about?
Okay, so
any relevance to our topic today?
Yeah. So now with most of the traditional medicines, they do work. We see them more able to prevent. So more of the preventative. So you could see in various locations, maybe we've taken samples, medical research. So if you see there's a particular location, you could look at them and then they would not have a particular kind of ailment. And when we look into what they either eat or what they use generally, we see that, okay, because they all do this, then we don't have prevalence of that kind of disease in that area. For instance, now, if you get to England, you would see that there's quite a lot of maybe non-communicable diseases in the Western world will be more of cancer, and that is because you see, number one, lifestyle, you see maybe the kind of things that are eating here and all that. And you will find out that maybe more in the tropical, you'll be dealing with cardiovascular diseases more, and it's all because of the kind of things they eat and all that. So the traditional herbs that we kind of work on, we work on different, if you look at the ICD, we take maybe a particular ICD that is the WHO classification of diseases, and say, for instance, we take something like cardiovascular, and we go to an area where there is not much cardiovascular diseases, and we study that area, and we begin to see what kind of things, what kind of herbs are in that area, and we've been able to work on quite a lot of them to see that, yes, because these natives, this is what they eat, this is what they use, that has not affected them much. So there is something in them. We start to investigate, do phytochemical research, look into the type of chemical constituents that are in those particular herbs that are being used there. And yes, we found out that sometimes their potency is not as much maybe to deal with the therapeutic side of things, but very good for preventative. So, yeah.
That's interesting. Dr. Kamara, I'm going to sort of ask you a similar question, whether you've seen instances where there are case studies where you can say, was their faith that influenced their health outcomes?
Well, I mean, you come across them most of the time. There are people who believe that without faith, they wouldn't have got to where they were in their illness.
What about patients that you've looked after? In actual fact, I'll turn it around. Have you seen patients who have absolutely no faith but have done really well?
Yeah, well, that's the interesting bit about it. I mean, people think that only those who are, if you like, religious, are the ones that would actually get positive outcomes in our interventions. Doesn't work like that. In the Quran, it's obviously written that Allah, enriches whoever he desires to do so too, if you like. So he gives wealth to whoever. And sometimes the wealth he gives you is actually a test in how you are, working, or maybe utilizing, or your newfound fame or wealth, if you like. How you use it. Are you going to be someone who's going to be haughty, someone who's going to be, be leaning on people, muscling in and doing and throwing your weight about, or are you going to be using it wisely in a way whereby you help the others who are less?
Do you think that's what determines whether your faith works or not, dependent on how you're going to use the outcome of that?
But I mean, it's simple that a lot of people, when they come to good fortune, most of the time would actually end up being, different in terms of how they conduct themselves. They
still got the good fortune.
Exactly.
If there's a divine being, they'll know that that's what you're going to do.
But the question though is, you are now given this test to see how you actually are able to stand the test of time within yourself. Because what you would think is, oh yes, I've got this big and that's it. And therefore it's through my hard work, without knowing that, look, there was something else that was in power of that. It's there in the Quran.
Also on this particular topic, there's a question that's coming about divine intervention, divine healing. If divine healing is a direct intervention, how can we claim divine healing when faith is combined with medication? So the question is, maybe I was smiling at that. I'm sure you'll have an answer from a Christian perspective, but I'll let you finish this one. So what this person is asking is that we're saying that there's a distinction that some things are divine healing, but the divine healing came with medication. So how can then you claim divine healing when it was a combination of the two?
Well, I mean, for you to get the medication, there has to be somebody who was actually endowed by God to create or maybe develop that medicine. So if you want to look at it, technically, the knowledge was actually given by God to that person for him to create that medicine, and medicine has come in to good use to you to actually help heal you. So one way or the other, there's an interplay, there's an interface between these two links, if you like. Whether you want to distinguish them or maybe delineate them, that's another thing. But as far as I know, somebody would have developed this medication like Pastor Esther there. She talks about pharmacy, yeah? There are medicines which are yet to be developed, and when they get developed and then they help heal, somebody who has been hopeless and maybe deteriorating. For example, we talk about metformin, which we know they use for diabetes, right? The control of diabetes. And yet all of a sudden, they found that women were getting very fertile and they were getting pregnant. Yeah. And in the end, that was something that nobody knew about. But then it came to a positive aid whereby that helped, improve things in terms of what they were looking for. So I know for certain that if you tell me that without the medication and someone got healed, that would be only divine intervention. But it tells you that if you fall ill, look for the treatment or look for help, seek help. If the help comes and you get healed, that is down to me. Doesn't mean because you have the medication, you will get well. I don't know if I'm looking, it's the reverse psychology. So if you're looking at it, you are saying because of the medication, it cannot be attributed solely to God.
Well, it was just a question that came on YouTube.
I know, that's what I'm saying.
What I find fascinating is that it's the same perspective, irrespective of what religions the background is. So I'm just going to move on to Dr. Ayo because
sorry, good. I just wanted to finish this. As I say, there's two sides to it. The side where you say, without the medication, there's no divine intervention. Well, I can tell you with the medication, there's still going to be divine intervention on the other side.
Absolutely, because not everybody gets healed with medication.
Exactly. So that's the thing with it, because as I say, if you want to delink them both, I doubt very much you'll be able to do that, because one way or the other, they're interlinked. Because I tell you what, there's a lot of time when there's certain illnesses that we say we've healed. Like, for example, I had a chap who had the most tremendous pain in their lives. And I know of a dua. This is it. We use, as you know, morphine is absolutely useless in bone pain. And that was being used. Now, all of a sudden, they called me and I said, I tell you what, I don't know what I can do because I can't do anything else apart from what God has ordained. But I know of a prayer that I can use. And if I do that and it works, please don't ascribe it to me. This is just God's work. And I know. I put my hand and I used the prayer that I'm talking about. And a day later, this person called me and said, this pain got better. And that's not down to me. I don't know whether it's the morphine has got a delayed effect or not. But I know that there's definitely the link between divine, and of course the illness and of course the outcome.
But was that person a believer though?
Absolutely.
Okay.
They believed in the fact, because that's the precondition. You have to believe in the fact that this prayer that I'm going to offer would aid the pain. And it worked. If you don't have belief in that, there's no point in doing it because it wouldn't work.
Thank you. I'm going to move on to Dr. Ayo now.
Thank you. So yes,
You've seen the comments about the interplay between divine intervention and healing.
I think the interesting thing is what Pastor Oludipe was alluding to before. So we are body, soul, and spirit. And there is a concept of because I think our understanding of health is evolving, and our understanding of how specifically mental health and strain can affect the body is also evolving and growing. There's a phrase that says, what the mind can't handle impacts on the body. And I believe that in the not too distant future, there's going to be greater research into the impact of mental stress and strain in terms of physical endpoints. Now, we do know, for instance, so people who have a positive mental attitude, so even if you just take faith out of it for a minute, people who have a positive mental attitude recover better and quicker from surgery. So soft beginning and hard endpoint. And I think that kind of evidence is increasing. However, I find it interesting, the concept of the phrase divine health. But
I'm just going to say, before you say that, that means that you feel that there's more positivity if you have a faith, because it's something that you have that enables you to feel that the outcome will be good.
Yeah, I mean, I think it can be. I think that because I think it depends on your relationship with God and your understanding of what God says his disposition to you are. Because some people don't have a great understanding of the fact that God says that, beloved, I wish above all that you would prosper and be in health. So actually, I don't have to question whether it's God's best or his intention towards me for me to have health. But some people are stuck there, So yes, with regards to the body, soul, and spirit, I think the concept of divine health, I think, is interesting, because I think that sometimes we may have used our experience of what's happening in the world and said, okay, well, this must be what God's best is. And I think I'll preface it by saying, in reality, we are temporal, physical beings trying to understand eternal truth. So I'm relaxed about whether I get it right or not, because I think that these are really big concepts that we may not ever answer in this life. But regards to that, I think God's best, just like Pastor Oludipe mentioned, was for us to have prevention and for us to walk in health. Now, I believe that God knew that we were probably going to do things to ourselves in our lifestyle, our eating habits, becoming more sedentary, all these kinds of stuff. And as a consequence of that, because God is all powerful, he's like, well, I can heal you, but that's not God's best. And like I mentioned before, I believe that wherever healing comes from, it's divine anyway. So I think the person who is asking that question, it may be separating things out in life. So like, for instance, my faith is impacted on how I am a husband, how I drive my car, how I parent my kids. I don't separate it out to just Sunday. because I'm trying to make it part of my everyday life. Now, some people may not necessarily use their faith in that way, but for me, I think faith is intertwined with every choice. Just like as a medic, medical ethics are intertwined with every choice that you make. You can't just have a session, okay, today I'm going to be ethical. I think, and I would ask the person who asked that question, like, do you pay car insurance?
I was just going to say that because I remember I met somebody who was deeply religious, and I said, oh, this must be a lot of insurance for this car. And he said, oh no, I don't pay insurance. My car's covered by the blood. So he never paid insurance. Yeah. Yeah. So it's the other thing that someone's had is, are you completely protected? Now, you said you've had a stroke. Did that ever come up in your interactions with other people of faith, that they would feel that perhaps your belief was not strong enough? And maybe that's what, in a young person like you, why would you have a stroke? Now, I hear this often where either somebody is having a problem having a child, and people say, well, you haven't prayed hard enough. Yeah. Haven't prayed hard enough.
I mean, no one did it to my face, so I don't know what they were behind my back. I mean, again, I do think, so again, I am relaxed about the fact that there are some answers that we won't get, and I was listening to, I was eavesdropping on a preaching that my wife was listening to by a lady called Anita Phillips. It's called How Are You? And basically the point of it is that often in situations where something hard happens, we ask God why, but the deeper question or the deeper thing that we are saying inside is, I'm in pain. Because in reality, even if God was to answer why, it wouldn't change the fact that I'm still in pain. And often what we're trying to do is say, I don't want to be in pain. And if we were to go to, I think the point of the preaching was, if we were to go to God and say, I'm in pain, God, it hurts me that I had a stroke. It hurts me that my dad died last year. It hurts me that somebody's got cancer. Can you help me with the hurt? Rather than taking God to task and asking questions, because, I'm probably not going to understand it even if he does explain. So I mean, obviously we did the medical things because I am a young person, and there are some things that you can research and figure out. So why, as a young person, would I be diagnosed with higher blood pressure? Why would I have a stroke and these kinds of things? But there wasn't anything that was found. But even in my practice, there are things I might explain to patients. Even with modern medicine, I can't explain your symptoms. So what I'm going to do is do what I can to make you feel better. And maybe there's somebody who may be able to take things further, but some of these things we might not be able to explain. I am relaxed about that.
Pastor Esther, we've had quite a number of questions about people who have faith but continue with an unhealthy lifestyle and exercise, and feel that their faith will cover. I think it's very, very, very similar to the covered by the blood issue with not having car insurance. How would you respond to somebody in your congregation, for example, who came to you with that real firm belief that irrespective of what they did, they expect to be covered by their faith?
Okay, so before I answer that question, I just made some few notes here about the divine healing. So when we talk about the intervention of the divine, we already know that there are things we don't see with our physical eyes. So even as we are now, there's no one who with their physical eyes could see even maybe things like the viruses and the bacteria. You can't see them, but you can see their effects, So if someone's got a virus, then it shows up. If someone's got a bacterial infection, then it shows up. But they will never, ever see the virus with their physical eyes. And then much more is the realm of the spiritual. So the spiritual, we cannot see them with our physical eyes, but we can, know by their intervention that whether there is a demonic, matter on this, or, angelic matter. So I just want us to know that the effects of the divine are things we cannot see with our physical eyes. So it's going to be very, very difficult to be able to explain everything, because you can't see it. You can go to a bigger level with viruses and bacteria, use the electronic microscope, and be able to say, okay, this is the kind of virus. But with the spiritual, there's no way we can use any means to see them. So their intervention can be non-explanatory, so to say. Then the second thing I was going to say about that, there are differences between miracles and healings. So miracle is when you get an instant, result. So Jesus did a lot of miracles. He did a lot of miracles, whereby, okay, somebody was blind, he sees immediately, and the disciples did a lot of miracles, and there are still miracles, that still exist now. But healing sometimes is a bit different. Healing could take a bit of a time, and that is many times people are looking out for miracles, and because that thing isn't happening just there and then, they think nothing is happening. No, healing can take a gradual process, and it is still, the divine intervention. We know of a man in the Bible that Jesus Christ was going to heal of blindness. And the first time he put something on the man's eyes, and the man said, look at what you can see. And the man said, I can see men like trees. So he said, okay, I still need to go further. So there was a process in that. So when we are trusting God for the divine, because it is divine, he could do it by healing, he could do it by a miracle. Let us just keep on holding on to him by faith. I've seen a lot of charts about faith and medicine. We have said faith is the evidence of things that we hope for. So you already have the evidence because there's a hope. That is faith. You're believing. Nothing changes it for you, because you know by various means that you are going to get it. So that is faith. And medication can be like what the Bible calls, the Bible says that the law was a schoolmaster. So that means that before Jesus Christ came, there was something that God needed to use to guide people. And so he gave them the law. So the law was like a schoolmaster before Christ came and saved us by grace. So also, if somebody thinks I'm not yet here to be able to say, I'm using just the divine healing, then the medication can be like the law, like a schoolmaster, giving you that health and relief until then you say, good, I'm good to go. So I just wanted to input that.
Thank you. I think from everybody, what's clear is that people feel that faith and healing and medication all work together. Now, Dr. Kamara gave us an example of when he's actually brought his faith to work by praying with someone. Have you ever brought your faith openly to work, and how you interact with your colleagues and perhaps patients when you're giving them medication?
Okay, so in very many instances I have.
But can you give me a quick example that people listening in will can identify with?
Okay, so when I have a patient, like I remember an instance, I had a patient and she thinks that everything the doctors have prescribed has not worked. So she was very frustrated. And then I said to her, amens could be like, it could be much more than what the doctors can see physically. So would you want us to pray about this ailment? And this actually wasn't a canon. And this is not actually even someone who believes this in the Christian faith. This was someone who believed in another faith, because we have consultation room, because she was frustrated and she was coming back to take another one. And already I could see within her, she believed this wouldn't work as well. So there was a lot of frustration. So I just said, could we go to the consultation room and I could just pray for you. And then I went in there and I prayed for her, but I was a local pharmacist. So later on, I had left the chemist anyway, because I work in several chemists. And then the staff in the chemist were ringing me and saying, oh, you took a lady to the consultation room. She's come back to look for you because, you know, she's got, and unfortunately, I didn't take her name. I didn't take her details, you know. I just did what I felt was in me to do for her at that time. So she said she came back to look for me because she's got good news, you know. And so I then went on to then get, you know. So yes, there are times when medication will not work. Yeah. And then we can say to them, we can offer them what we have and what we know can work. And you know, it has worked in that instant. And then to the question,
just to this is in conjunction with their medication, though. You'd have advised them to continue taking their medication. But
it was not a chronic matter. It was an acute thing that if the medication were to work, they would know it worked. If it didn't work, they would know it didn't work. So they have given them, you know, a couple of medications to treat that ailment, which didn't work. And she came for the next one. And in her, she was like, you know, it's like they've not really known the diagnosis or known what to give her. So that's when I saw the frustration and I took her in and I just prayed with her. And definitely she would have taken what the doctor gave her. But at least even that prayer, like we said, also lifted her spirit. So could be that with the prayer, it all did the job, or because she might have taken that medication without the prayers and she will not have the same result.
Okay, I'm going to move on because I know there are lots of questions. So I'm going to move on and ask you some of the questions. You can just keep it short so that we can get through as many questions as possible. So this is a question I'm going to ask all three of you because it's come up, and I know that when I'm asked about my faith, because many of you know I work with premature babies, they will say, this is one that says, I'll read it out verbatim, and I'll ask you, Dr. Kamara, are people destined, and the destined in inverted commas, to have certain diseases? And if so, how can we convince people, believers, to take medication if they feel that in actual fact, this is God's will? Quite provocative, but I'll put it to you, Dr. Kamara.
I don't know. It's thank you for the question, but one thing I can tell you is,
if you just give me a couple of minutes, so I can move on.
I know it's just a very convoluted question because as things stand now, one thing I know for certain is that nobody can tell you that I'm destined to have such a disease, because at the end of the day, if you look at hereditary factors, you could say yes. You see what I mean? Because the hereditary factors are ones you can't do much about. You don't choose where you're born. The genes determine that. So if you look at it from that perspective, then yes, no problem. It's something like you talk about hypertension, you know, if you inherit the genes, then that's it. You talk about breast cancer, if you have the BRCA gene, you are more likely to develop it than not. So there are things in that lineage, if you talk about that. However, you look at nature and you look at nurture. Now, nurturing is where that comes in, whereby there's certain illnesses that you know, if you are 200 kilograms, you definitely would have certain things that you would have.
So you know, hypertension. Things that are already in your DNA.
Exactly. Yeah. So in your DNA, that's one thing. But whatever it is that you can do with your natural self in terms of how you conduct yourself, sedentary lifestyle, the smoking, the alcohol, and all the other things, that itself would add weight, and with that comes the consequences. So if you tell me, is anyone...
What you're saying to this person is that even though you might be destined, there are things that you can do.
Absolutely.
And part of these things are your faith and also the medication that you can take.
Brilliant. You rounded it in one, because the fact remains simple that I talked about this in my talk on hypertension, where there are certain things you can inherit, but there are certain things you don't inherit, but you can do well with, that you could actually control it. It's as simple as that.
Ayo.
Okay. About Esther, I mean, I think the short answer is it's not something that we can answer shortly. But I think there are some spiritual oxymorons that appear to contradict. So, for instance, I'll use an example to explain. When we talk about faith and coming to faith in Christ, are people called, or do we make a decision? So the way that I visualize it is that there is a door. On the front of the door, it says, all who will come. So you walk through the door, you look behind the door, and it says, chosen before the beginning of time. Both things are true, but I can't explain what appears to be the oxymoron. So with regards to the, because this thing about God's will and God's perfect will and God's permissive, it's I mean, people have spent years and years and years and years debating it, so we're not going to solve it today. However, I do believe with Dr. Kamara that there are things that we can do to mitigate risk. I have a friend who's a lifestyle medic, and basically he says that genetics loads the gun, lifestyle pulls the trigger. So we have to be conscious of what is our responsibility to make sure that we mitigate and walk in divine health as God purposed. Because just like Dr. Oludipe says, I believe that a lot of these indigenous cultures give us a glimpse as to God saying, actually, if you eat that leaf, you won't get that. If you have that bitter, then you'll get better. You know, if you bask in, these kinds of things. Yeah, I'll say that and let you move on.
Okay. Dr. Esther, what I'm going to ask you now is there's a question from CD here, that there's been a lot of discussion about the influence of people's faith on their willingness to take the vaccine, just the willingness.
Okay.
But one of the things, and I wonder whether you might have a perspective on this, is that has this always been? Is it just that COVID has exacerbated this? Is the same unwillingness with the flu vaccine and other health screening? Do we see the same differences with maybe taking up breast screening or cervical cancer screening? Is it just with COVID vaccine? And I'm sure as a pharmacist, you're involved in the flu vaccine as well.
Yeah, so there's a lot of cultural underlay. So we can't all wrap it around, just faith, as we are Black Africans and Caribbeans, we're not very disposed to trying new things. So I want to say that, it's not all based on faith. It's much more on maybe just our culture. We're not wanting to put ourselves forward to be experimental, animals, so to say. So I think just saying that is faith won't be right. It's more of our culture, and there is not much you can do to change people's culture because it's what they have, basically grown up with. So it cuts across everything, not just COVID.
As well. You say when you say it's grown up with, I suppose so. And what about second generation? Because we've got first generation, second generation, third generation Black African and Caribbean people. Are you seeing the same issues? And is it with other screening programs as well, or is COVID just a particular specific because it's brand new?
No, it's not just COVID. Because culture is usually passed down. Culture is very, very much passed down, whatever generation. It could just be the other, maybe more enlightenment could reduce certain aspects of it, but culture is basically passed down from generation to generation, and it never it doesn't even depend on whatever locations they are in. So it's not just only COVID with the vaccine, is generally in all aspects of we will see that we're not disposed quickly putting ourselves forward, maybe to the medical, Black people are very hard to reach. I dealt with a case in our center where I could already see the symptoms of stroke on someone, and thank God we acted fast because I have a blood pressure machine at the center, took the blood pressure. It was out of the room, and the person was still moving about. And we didn't even wait for the ambulance. We smuggled him into the car, took him to the hospital, and we just quickly nipped that before anything happened. So it's just
I'll make
kind
two
of our
comments
culture.
about that. One is about, I think, because we have things like this, because we've got the Caribbean African Health Network, that we can't be defeatist about this, because we have to move that dial. We have to give people more information so that they can make the right decisions. The problem is that at the beginning of the pandemic, I found is that I didn't see any videos that came around to me supporting the vaccine. All the videos I had were videos that were about implanting metal and what the COVID vaccine does to you, about 5G. I didn't see any. So I just felt that it was, if you were at home just sitting down, getting the messages from WhatsApp, there weren't any positive messages. There weren't anything that you could actually now weigh up the two aspects of should I or should I not? It was just an abundance of negativity. So this platform, I felt, would give people at least some something where they could come and ask their questions and speak to health professionals who've actually had the vaccine.
Yeah. Can I just say that news generally around sell more when they are not
bad news? Yeah.
Yeah. So if people want people to go to their website, to visit their website, they're not going to put something good there. They're going to put something that
I think it's incumbent on us as health professionals to give the right, that not spin a positive spin, just the facts, so that people can make a decision. The second thing is about the phrase hard to reach. I know that I've had people who decide they want to engage Black women in talking about why the poorer outcomes for when you have your babies. And they've set up a research project and said, we can't find any Black women. And then they've come to us and we've given them loads of Black women to contact. So if they know the right place to go to, we're suddenly right there out in the open. They just need to know where to reach us. And we're very easy to find because we stick out. We do stick out.
Can I jump in and
yeah, the IO, please.
Piggyback on the thing we talked about culture. So 1 Samuel chapter 15, verse is 15. So this is in the context of God told Saul via Samuel to go and destroy the Amalekites. Saul was like, yeah, I did it. I did everything you asked me to do. And then Samuel said, like a Nigerian mother, what is this bleating of, of sheep I hear in my ears? And Saul said, the soldiers brought from the Amalekites, they spared the best of the sheep and cattle to sacrifice to the Lord our God, but we totally destroyed the rest. What I'm talking about is culture. So that especially those of us who are churched, or who have come up with, in and around church, there is a language that we use that may not necessarily be fertilized by a personal relationship with God, but you can say things that sound religious or faith. Now, what Saul said is, we're coming to sacrifice. You know, what's wrong with that? And what the reality is that you would think somebody who was saying those words would be operating in a way where his relationship with God was strong just because he said the right words. But Samuel was like, no, you've not done the right thing because God didn't want you to do that. God wanted you to do something else. And I think we have to be mindful about the fact that some of the disagreements and the arguments that we're having, they're cultural arguments, they're not spiritual arguments. And we have to be mindful of that when we talk about faith and health. For instance, I'll give you a funny example. I heard of a preacher from a certain part of the world, you can guess. And he was like, you wives, you don't even kneel down for your husband when he comes into the... Now, in certain cultures, that's fine, but you can't take that as a universal, this is how marriage should be for everybody. But he was using that on a faith platform to minister to masses. And I'm saying that, it might be appropriate in some places, but culturally it's not applicable everywhere.
Absolutely. Definitely not applicable everywhere. I think Charles, thanks for your comment. I think the people on YouTube talking about the hesitancy and why people haven't put themselves forward. And a year ago, almost a year ago, we had a large event on CAHN where we asked people to just tune in, and we just had a number of Black doctors who had the vaccine, and some of the comments that came up are valid about why people are worried about things that have happened in the past, which are not so far that in history that we remember them. So the Tuskegee men with syphilis. So, you know, these are the things that cause people concern. There's also comments that we haven't talked enough about the side effects of COVID, and that it seems as if people are minimizing those side effects. But in actual fact, what is overwhelmingly obvious now is the beneficial effects of the COVID vaccine. The fact that we're seeing a lot less deaths and people who are being affected because of the vaccine program. And we cannot minimize that. We just can't as health professionals. It's our responsibility to make sure that we present the facts.
I think it's also useful, sorry to jump in, to talk about how side effects are documented. So one of the things that when people are coming to hospital and they're so fearful about, oh, will it give me side effects? My response is that there is nothing that is devoid of side effects. Anything that we can do, even taking blood, me sitting here, me checking your blood pressure, all these things have side effects. And legally, the way that side effects have to be documented is that anything that happens around the same time of the thing has to be documented as a side effect. But we don't necessarily know that these things are causative. It might be associative. So I've had some people who have said, I've had the COVID vaccine and I've had certain things. Now, I don't know. It may be that the COVID vaccine gives people headaches, or it gives people a rash, or it gives people, you know, funny neurological symptoms like pins and needles. However, I agree with you, Dr. Ngozi, that in reality, the benefits far outweigh the risks. And I am one of those people who was quite cautious about the COVID vaccine from the beginning. The reality is last year, there was lots of stuff that vindicated our position as Black people of being cautious about how the establishment treats us. So George Floyd and all that kind of stuff. So my thing was, you know, worst, let's say the COVID vaccine is terrible for Black people. Worse, all that's going to happen is, oh, sorry, mate, you know, because the establishment has shown that they don't really care about us in the way that we expect them to. But I was listening to some CAHN stuff and some other church stuff, and essentially I was challenged that God honors faith, not fear. So if my decision to not take the vaccine is based on fear, God is not going to honor that. Also, in terms of the speed at which the COVID vaccine has come up, actually, if everybody in the world is concentrating on one thing, why wouldn't it be quick? Why can't I believe that God has helped people to be able to do research and bring things forward? So that was very useful for me, because I was very, very skeptical, you know, at the very beginning.
I agree. The 2020 was not a year that this country, in its management as well of the whole pandemic, endeared you to think that they had the best policies ever. You know, the number of Black doctors that died in the first wave was quite worrying for many Black doctors. The way the whole thing was handled, and we needed to make sure that they were handling the vaccination program in the right manner. But this is one thing that we seem to have got right. I'll just go to a few other questions that we have here. The other thing I was going to say, just before I go to the questions, is I have to bring my experience to this as well. I look after premature babies, and these are babies who sometimes weigh about, our smallest babies weigh about 500 grams. And to put that into context, an average baby weighs 3.5 kilograms. So this is a baby who's a seventh. So you can fit 7 babies into an average baby. That's how small they are. And we give them medication every day. And many of these medications have not been tested on babies because you cannot, because the number of babies that you need to be in a trial to make sure it works well. So we have to ensure that we're using the best evidence possible, and we have really good outcomes. This is what I do every day, and I can see the effects of that. But it's clear that even lots of medications we use, everything has side effects. So the fact that a medication has side effects, or the fact that a medication hasn't been tested in the right way or in the right population, doesn't always mean that it's not possible to use that. And I'll just add that in because it's what I do every day. I also just want to say a quick shout out to Sedi Frederick. I hope I've got the pronunciation of your first name right. And he's doing some amazing work in London. He's the chair of Kent and Medway Integrated Care, and he's a great supporter of the Caribbean African Health Network. And he's put lots of helpful comments in the chat about what they're doing down in Kent with the COVID vaccination. So thanks for joining us this morning, and thanks for all the support. The other fact that he's put in is that in London, the intensive care beds, 80% of people with COVID are unvaccinated, and that's just a fact, and which will be similar in Manchester as well. Okay. The other thing that has been highlighted is that if you can tell us about times when, I found it interesting that both Pastor Esther and Dr. Mohammed has actually prayed with their patients, because there are times when sometimes I've been moved to, but I'm very conscious of also things that have been in the media of doctors who have done this and have got into trouble for it. So how did you breach that sort of conflict about that? Have you heard of the doctors who have approached patients in their care and have said they want to pray for them and have actually been taken to the GMC?
To me?
Yes.
Yeah, I mean, in fact, it happened to a colleague right in front of my very eyes. This is not, well, it wasn't reported to the GMC, but he was stopped from working. And I think the understanding was he tried to ingratiate his views on the patient, and it's the patient that actually complained, when in actual fact, it was the other way around. That was found latterly after some sort of investigation. But as you know, when these things happen, mud sticks as it happens. But in my case, it was actually the patient that requested it. So it was not like me, sort of ingratiating my views on them or maybe imposing my standards on them. They asked for it, and I said, well, if you believe in that, and I sought legal permission, and it was approved, and then I went ahead and did it. And subsequently, they came back and thanked me, and I'm not saying I take credit for it. The Almighty would have, but not me. Maybe he channeled that through me, and I'm pleased and I'm blessed that that was a path that was chosen for me, and it worked in that instance. So one thing I can tell people is that we always concentrate on the macroscopic side of things, what we see as human beings. What we are oblivious to is what we have microscopically. What is happening there? Like you say, healing happens. It's not something that you'd flick your fingers or flick the light bulb and it works. No, it's a gradual thing. Even scientifically, that's how it's been proven. If you had a cut here now, it wouldn't heal immediately. Even if you were stitched, it would take some time for it to heal. So if you are looking at mapping the progress that you're having, then you have to have some indication of what is happening there. So you're not just thankful for the negatives that you see because you think, I should have achieved this now and I haven't done that. But then what about the positives that you're not aware of? Are you taking that into consideration? And I think that is where, the difficulty comes in, because all we want as human beings is that we see this now, we want it now. It's not without reason that people say patience is a virtue. If you look at the the names or the attributes of Allah, subhanahu wa ta'ala, there are 99 of them. And the 99th one is the most patient, as-sabur. Now that tells you something, because without patience, you will never get to anywhere you want to go. It's as simple as that. Whatever you have to achieve, you have to have that patience. And that's why he says in the Holy Quran, Inna Allaha yuhibbu sabirin. He says, Allah loves the patient. It's only with patience that you can achieve success. There's no questions about that. So therefore, in medicine, that's what leads me forward. I persevere with my patients because I know I'm on the right track. And sometimes it might take a bit of disgruntled measures and things like that, but I achieve that via the fact that I am actually, I'm confident in the fact that with this patient approach, I will get there. And most of the time it works. No questions about that.
Thank you very much. Ayo, have you ever prayed with a patient?
I don't think I have, to be honest with you. In short, I don't think I have. I think, I'm not anti it, but I think I'm a bit like you in terms of I'm cautious about. I've seen people have unnecessarily overbearing managers for other reasons. So but no, I don't think I have. But I'm not.
Do you think your patients know that you are somebody with faith?
It's not something like I don't wear it on my sleeve. Hello, I'm Dr. Olatoye and I'm a Christian, like that.
Your colleagues know you're someone with faith.
Oh yes, yeah.
Okay.
Next comment.
Yeah. Well, you've given us an example that you have prayed with a patient. I just wanted to know how that came about. I know you told me what happened, but were there any ramifications of that, Pastor Esther?
Okay, so I think when patients come to us, either as a doctor, a chemist, a nurse, they're looking for two things. Number one, they're looking for an engagement, because it does help better when you can actually empathize, or engage with them. So they're looking for that. Then they're looking for the professional aspect also, to say, okay, you're going to assure me that this is going to work. So anytime I'm dealing with a patient, I'm actually trying to deal with them on those two realms. So I'm going to say to them, okay, the doctor has prescribed it. Like yesterday, I was talking with a patient. The doctor has prescribed something. I really didn't think it was appropriate. And I sent one of our staff with a note back to the doctor. The doctor insisted. Now the patient is looking at me to give him that assurance that what that doctor is written is not going to have adverse effect, So I had to kind of say to them, at least we are aware now that what could happen. So you watch out. If it does happen this way, then stop the medication and get back to the doctor. So they're looking for that kind of an assurance, and we have to be able to provide that for them. So in the case of patients, because I was still that you said yesterday, one of the patients had to take my phone number because she wants to go further with a discussion on the spiritual side. So when we see that opportunity, we make use of it. It's going to be the request of the patient because of the way we have engaged with them. If that doesn't happen for any other patient, well, we really don't. We've just done the professional. But if it does happen, then we take the opportunity and we'll be able to introduce them to the divine or the spiritual.
Thank you. Charles, I know you're here and you're helping me to monitor the chat box. Are there any questions? I've tried to group a lot of the questions. Are there questions that we haven't addressed?
I think Sectin has put some questions in the chat box.
I saw one of them, but he just said medical error.
Okay, he's raised his hand, so we can ask him first. Yes, Sectin.
Yes, I am a victim of a medical error.
Okay.
I was diagnosed with prostate cancer on the 17th. I was in hospital for about 10 days at the North Middlesex. And on the 17th of February, I was diagnosed with prostate cancer.
Okay.
Coincidentally, I also happened to be deputy chairman of the United Kingdom Cancer Black Care, and our chairman is Professor Frank Chinagundo, MBE.
Yeah, I know Chin.
I used to be at St. Bart's now.
Yeah. So what's the question?
The two consultants who were dealing with my matter at the North Middlesex invited me for an interview and decided what they're going to do for me. They're going to do the gold standard. And I thanked them for their efforts, and then I rejected it. I said, I prefer brachytherapy. And they asked me, what is that? We don't do that here. And I said, yes, I know. I'm deputy chairman, Cancer Black Care. And we had convinced the government to send doctors to Washington State, which is just south of British Columbia in Canada. It's in America, actually, to go and learn all about it. They returned, but they came from York, somewhere in Yorkshire, you know. So I told them, and they were aghast. They said, oh, well, if that's what you want, we'll find out who does it, but we've never heard about it in London. So they told me to wait. After about 2 to 3 months, I got a telephone call, said there's a letter in the post. They found somebody who could do it for me in Northwest London. I was very happy, and the operation was scheduled for the 8th of August. Coincidentally, my wife is a nurse. She's got theater experience. She was actually, at that time, she said, oh, you should be all right. I'll come and see you at 5 o'clock.
So it's a really interesting story, but I just want to know what it is that you wanted us to respond to. Was it the error in the diagnosis, or was it that there was treatments that were available in other countries that are not available?
Let me come to the error. Was most probably the surgery was okay, but the anesthetics was inappropriate, because I am a victim of what they call the sickle cell trait. Mm-hmm. So when my wife came earlier than she promised, about 1 p.m., I've never seen her run like that, like an Olympic athlete. She did what they call, you American people call crash. And they came and injected me with something, put me in a chair naked, but to give me a blanket. It was like I was in a freezer. All of a sudden, the place, my surroundings were changed, started changing. I was in a room which was about 2 feet thick concrete, because I was radioactive, and I had been warned that I should not play with children or bounce babies on my knees or that sort of thing. And she explained to me that when she came and checked me at 1 o'clock, something my beat was 4. See, I was blue-black. I was going. So I raised this issue with the Department of Health, and I also copied the cabinet secretary in those days about it.
Have they responded to you?
Oh, yes.
Okay.
Because I'm ex-Minister of Defense, AWSM, RAF Oxbridge.
So is the question that, is there medical error? I can answer that very, very, very easily. There is. Yes. And in all hospitals, like anywhere else, there will be. And they will never get rid of it. As long as you have humans involved in anything, there will always be error.
Yeah.
So I'm not saying that's acceptable.
No, I know. I know. Yeah. Well, the point I want to highlight is to enhance awareness
of medical error.
Anesthetists and surgeons when they are treating patients who might be full-blown sickle cell or what they call the trait.
Okay.
You know.
Okay. Thank you very much.
The second issue, I have taken a very keen interest in this COVID. Okay. And because of many
people have.
Yes, well, I'm 84 now. After I retired.
You've had your jabs?
Pardon?
I hope you've had your jabs.
High risk, yes, I've had all 3.
Oh, thank you so much.
And the reason why I had them is because I didn't know any better or any different. Now,
Oh,
and what? And I saw. I'm seeing Dr. Kamara there. I've raised this issue with him at another venue, and.
Honestly, I'm going to have to just so I can address the issue. So the COVID vaccine, what is the issue?
These vaccines that are being imposed on us have not gone through all the 6 stages. They are all stuck at, they are what I call rushed vaccines. They are stuck at stage 3. So we who have taken it are virtual guinea pigs. Now, being a non-medical person, I'm an engineer, and my own approach is, if you give me a vaccine, and then you come back a few months, say, oh, you need another one, and then you come back again, you need another one again. I begin to suspect the original you gave me was a fake. You see? So I've started writing a book about it, about this issue, and I'm a member of the Society of Authors, and I showed it to 2 publishers, and one of them.
But what I'm going to do now, Seth, I'm going to answer those questions because you've raised some very interesting points. So I think you need to just give us some time to answer that. But thank you so much for sharing your views with us. Thank you.
Sorry, I just want to thank Uncle Setin for coming. You know, he's my countryman and he's my alumnus. Okay. Right? We know, yeah. So yeah. Now, Uncle Setin, I think there's an offer there from Charles that we would like to interview you, and it would be a good thing. As I say, you've raised some very good points there. And I think the forum we have now is probably at the point whereby we'll not be able to do justice to the questions or the issues you've raised. I think we'll have to take that off air and maybe do it at another time, you know. But clearly there is medical error, as you know, my colleague is saying. There's no questions about that. Secondly, the only question I'll have to you is, why have you taken the 3 if you think it's all scientific and it's still at that stage where it's not been approved? Now, that is the message we need to be sending across to people, not that it's at that point. Because if you've taken it, you actually, you know, kind of counteracting yourself in a way whereby you've taken it, but yet the other people, you tell them that they shouldn't because of the fact that they've not been proved scientifically. I think that is not the message that we need to be sending out.
I think because it's at the end, and I think it's really important that at the end of any of our talks that we have messages that we would like to leave with people. What I'm going to say is that ask each of our colleagues to round up. Joe, it's nice to see you. I hope you've been listening so that you can.
I have actually.
Yourself, listen, since you've been listening, if you can just give a message that you'd like people who have tuned in today to take away with them.
Thank you, Ngozi. So my name is Joseph. I am a GP in Rochdale. I am also a pastor of a local church here in Manchester. My vaccine stories, many of you are already aware of because I've been on the program. I just wanted to quickly respond to the lovely gentleman that has just spoken. Because I was involved...
We have about 6 minutes left, Joe. So
that's fine. Because I was involved heavily in the delivery of the vaccines in my local patch, we researched into the vaccine process, and it followed all the process of vaccine production. The only difference is that all these things were accelerated because of government will, which my colleagues and yourself have rightly highlighted. So the message really is that this is not a rushed or shortened process. This is a process that I've gone through, but because of political will, everything was sent through on a fast-track basis. Last thing I just want to say that this vaccine has actually saved a lot of lives. I lost one of my trainers who trained me as a GP coming up. This is not something that somebody told me. He's a real human being who was my trainer and died from COVID. A lot of times, Afro-Caribbeans are skeptical because we are not as close to this thing as possible. And I want to just encourage people that, look, stuff are happening. The vaccine has decimated the effect that COVID could have had. Thank you.
Thank you so much, Joe. Thank you. Mohammed, any last words?
I'll echo what Joe has just said. I tell you what, imagine 1918, you had 500 million people. And out of them, 55 million people died. Now we're talking the same duration, 2 years, and we're not even up to 6 million deaths yet. I tell you what, we have to be grateful to these vaccines. Whether you like it or don't like it, I guarantee you the COVID vaccines has saved lives. Yeah, the side effects we're talking about and all that. I tell you what, the benefits, I have seen that because like Joe has said, I have seen my colleagues, yeah, I've buried people that are very close to me. And I tell you what, we as the Afro-Caribbean or BAME community people, we are more at risk because of the vitamin D issues that we do have, because of our skin and because of the melanin. So please, 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 my people, if you take nothing from this talk, remember that the vaccines that we do have saved lives. And you don't want to put yourself against this monster, as I call it, because we have 16 variants.
I'm just going to move on now because we can
so
talk
16
about
variants you have to save yourself from. Yeah, thank you.
Pastor Esther, we came to this not just about COVID, about faith and health. So in your roundup, if you can just say a few words about that. Thank you.
Okay, so just to say that we may have 3 to 4 categories of people that exist. Those who would just operate by faith alone. And if that is you and is working, please go on. Those who would say, well, I have faith, but because I've been diagnosed of one thing or the other, I'm going to use medication, I'm going to rely on the medical. Please, if that's your level of operation and it's working for you, keep with it. There are those people who do not have faith at all, and they're just going to rely on medication. If that is you, if it's working for you, go ahead with it. If it's not working for you, seek help. And then we will have those who would not use both faith and medicine. And if you think you need help, either on the medical or on the faith level, you've got everyone who is on the platform. You can go back to CAHN and say, I want to know more about it. So just saying to those 4 categories, what at the end of the day you want is what works well for you. Thank you.
Beautiful summary. Thank you, Pastor. Thank you for coming. Dr. Ayo.
So my thing is that we've talked briefly about the fact that we are body, soul, and spirit. And in my opinion, true health is addressing issues in all these areas. We've gotten very good at talking about spirit. We've gotten very good at talking about body. We're not as good at talking about soul. And I believe that, the ancient people, I think it's a French word, believed that when body, soul, and spirit was in a sense of balance, that we were in a state of ease. And when we weren't, then we were in a state of dis-ease. That's where the word disease comes from. And I believe it's important for us to make sure that we're addressing all these issues, because fine, you can, it's even with like the faith and money and all that kind of stuff. If you can have money, but if you don't have health, what's the money for? If you have health, if you don't have money, then you can't enjoy it. Similarly, if we are not intentional at making sure that we are looking at all these issues, I think it's going to be, we're not going to live the abundant life that we could.
Thank you so much. I'd just like to say thank you so much for all of you that have joined us this Saturday afternoon, morning, and for contributing with your questions, which has enriched the discussion and your comments. And I'm just going to hand over to Charles to give a roundup. But thank you to all our speakers and thank you from me.
Thanks, Dr. Ngozi, and to the panelists. I wonder if, Sedi, you want to say a few words? Really delighted to have you on the call. And,
nice.
one of the influential, Black people, Black elders in our community. So I wonder, Sedi, if you want to say a few words.
Thank you, Charles. And can I just thank all of the speakers who contributed to this really, really interesting event. I always maintain that our future is in our own hands. And these sessions provide inspiration, education, and information. And I don't think we can ask for any more. I put it in the chat. I salute CAHN for the work they're doing, extraordinarily powerful. And as a community, we are becoming more and more well-informed. So all I can do is just thank you all. I am genuinely honored to be part of this great NHS, and there's a commitment to try everything we possibly can to reduce the health inequalities that many of our communities face. And working with partners like CAHN and others, we will get there. It may take some time, but we will get there. So thank you very much for giving me just a couple of minutes just to share some thoughts. So thank you very much indeed.
Thanks for that, Sedi. So, once again, thanks, Dr. Ngozi, for giving your time week after week. And to our panelists, we also have Dr. Joe, who is our, clinical lead on mental health, and Dr. Mohammed Kamara, or, Mo for short. You give time and time, week in, week out, and we call you at short notice. And Dr. Ayo, you've become part of the team. Pastor Esther, who is one of the funding directors for CAHN as well, grateful to have you back. I mean, someone is put, on YouTube, Faye on YouTube said that, she also believed that the vaccine was rushed until her black GP told her that is because government invested a lot. We all part of the community, those of us who've had it, the jabs. And, as Sedi mentioned, it's about how we spread the good news, how we engage, how we gather the concerns of our community so that we can feed that back and get policymakers or our own clinicians to really, respond to those concerns. So CAHN, we always create this platform because we want to engage people. We want to hear what your concerns are. And this morning, people have joined us from Germany, Spain and other places, because together we're stronger as a community. So keep spreading the word. If there is someone who is still concerned about having the vaccine or, any other medical issue, they want a second opinion, by all means, get in touch. We have volunteer doctors, GPs who will make themselves available. We have experienced Black nurses as well who volunteer for us. Next week, we're going to have our consultant rheumatologist back, talking about lupus and fibromyalgia, because that is another condition that, really impacts on our women. And so please spread the word, and we look forward to seeing you. The sessions are live streamed to YouTube and Facebook. So if you go on those pages, you can get, the web links and share it with families and friends, really. And we, as the Caribbean African Health Network, will always be guided by the evidence. We'll always work with our clinicians, and we'll always serve as a bridge, to really get your concerns addressed. So once again, to Dr. Ngozi, to our panelists, and volunteer doctors who give their time all the, week in, week out, massive thanks. And we will see you on Tuesday when we look at nutrition and physical activity. Thank you, and have a great weekend. Take care of yourself. And if you're an adult, go for your booster jabs,
Are you there?
CAHN Health Hour. Black health advice. Get informed today to have a better, healthy tomorrow.